Hello, I'm Dr. Kenyon Meadows, board-certified radiation oncologist with Southeast Georgia Health System's Cancer Care Centers. Let's take a couple of minutes to talk about cancer staging. Staging is the process by which your doctors determine how much cancer you have in your body and exactly where it's located. It almost always involves a biopsy or taking a sample of a suspicious area. They may suspect this area contains cancer cells because of symptoms or perhaps a routine screening test such as mammogram, PSA blood tests, or colonoscopy indicated the possibility of cancer cells. Once a diagnosis of cancer is confirmed, specialized radiologic tests can be used to confirm the stage. Determining the stage has a profound impact on your treatment recommendations and your anticipated outcome. Let's go through an illustrative example of one of the most common cases I see, which is lung cancer. And please keep in mind, this is by no means a comprehensive review, but rather I want to highlight a few key areas. Here we see an example of a relatively small area of lung cancer that's less than 3 centimeters in size. There's no evidence of any spread to the lymph nodes in the middle of the chest or any other organs besides the lung. This is stage 1, and this patient will be offered either surgery or very high dose per treatment radiation, such as that offered on the CyberKnife, over a period of only 3 to 5 days. With either approach, this patient would be expected to have a good outcome. Here's an example of stage 3 where the tumor has spread from the lung to the lymph nodes in the middle of the chest. Most often, these patients are treated with multiple weeks of radiation and chemotherapy at the same time if they can tolerate it. The cure rate in this situation is much more modest, averaging approximately 20%. In stage 4, we have clear evidence that there has been spread of the cancer beyond the lung to other organs, such as to the liver or bone. In this scenario, chemotherapy is the usual initial recommendation with the goal of prolonging the patient's life, although there is no expectation of cure. Radiation therapy is sometimes added as well with the goal of helping with certain symptoms, such as to ease pain. I hope these examples have illustrated the paramount importance of how arriving at an accurate stage is a crucial step in your overall cancer care. Luckily, technology has progressed to where we can catch lung cancer in stage 1 when the outcome of being cured is the highest. Stay tuned for next month's video blog to learn about life-saving screenings. If you have follow-up questions, please submit them in the box below. Thanks.